Okay, let's talk about the pediatric ATI exam. If you've been stressing out over the genitourinary and renal sections, you are in exactly the right place. We are going to spend the next few minutes totally cutting through the noise and focusing on the high-yield stuff you absolutely have to know. Let's turn that confusion into some serious confidence. So here's our game plan. First, we're going to tackle the basics, UTIs and enuresis. Then, we'll dive into some of those tricky structural disorders. After that, we'll really focus on mastering the 3 big renal diseases you are almost guaranteed to see. And we'll wrap it all up with a super fast, high-yield review. Ready? Let's do this. All right, first up, UTIs and enuresis. These are some of the most common issues you'll see in pediatrics. If you can nail these down now, it builds a really strong foundation for the harder questions that are coming later. Let's focus on what you need to know for the test. So let's get this definition down cold, exactly how the ATI wants you to know it. Enuresis isn't just any bedwetting. The criteria are specific. It's inappropriate urination happening at least twice a week for 3 months straight in a kid who's at least 5 years old. And you got to know the 2 types. Primary is when the child has just never been consistently dry. But secondary, that's a big one. That's when a kid who was potty trained starts having accidents again. That should be a red flag for you to look for some kind of stressor. Now this is a classic ATI-style question. They love asking how a UTI looks different depending on the child's age. And here's the key. In infants, the signs are just vague. Think about it. Unexplained crankiness, not eating well, maybe a random fever. It's really nonspecific. But in older kids, the symptoms get much more textbook. You'll see that classic burning pain with urination, or dysuria, along with belly pain and having to go all the time. Okay, this slide is pure gold for any of those client education questions. You need to know these prevention tips backwards and forwards. Wiping front to back is the classic, but don't forget the others, like avoiding bubble baths because the soap can be a real irritant, and encouraging kids to empty their bladder all the way because leftover urine is just a breeding ground for bacteria. These are easy points on your exam if you know them. All right, let's build on that and move into structural disorders. For this part, the key to acing these questions is super simple. You see the problem, you immediately know the number one thing the nurse has to do. That's the connection we're going to make right now. So, bladder exstrophy. This is a pretty dramatic and very serious condition where the bladder is actually exposed on the outside of the body. If you see this on your exam, your brain needs to immediately scream one thing: protect that bladder. The priority, the very first thing you do, is cover that exposed organ with a sterile, non-adherent dressing. This is a big-time surgical emergency. Hypospadias and epispadias. This is all about location. And trust me, the ATI loves to test if you know the difference. So here's how you're going to lock it in forever. Hypospadias means the opening is low, on the bottom or ventral surface. Think hypo is low. Epispadias is on the upper or dorsal surface. Think about how an epidural is placed on top. Hypo low, epi upper. Got it? Okay, here's a rapid review of 3 more disorders. For phimosis, the foreskin is just too tight to pull back. The key teaching point here is do not force it. For cryptorchidism, we're talking about undescended testes. The key management is a surgery called an orchiopexy. And for hydrocele, which is just fluid in the scrotum, the key fact is it usually goes away on its own within the first year. Just connect the problem to the solution. All right, this next section is absolutely critical. Seriously. Knowing the difference between acute glomerulonephritis, nephrotic syndrome, and hemolytic uremic syndrome is one of the highest yield topics for pediatric renal. We are going to make these differences crystal clear. Let's try a little case study to get your brain firing. So you have a school-aged kid. They've got swelling around their eyes, they have high blood pressure, and their mom says their pee looks like tea. And you find out they had strep throat a couple weeks ago. What is screaming out at you? What do you think is going on? Yes, if you said acute glomerulonephritis, you are 100% correct. That whole clinical picture, the recent strep infection, the puffy eyes, the hypertension, and that tea-colored urine from blood, that is the absolute classic presentation of AGN. Let's break it down even more. Okay, listen, screenshot this slide, print it out to do whatever you have to do, because this comparison table is everything for your exam. The number one thing to look at is the protein. In AGN, you lose a little protein, but in nephrotic syndrome, the protein loss is massive. And because all that protein is leaving the blood, you get this severe full-body swelling called anasarca. Also, lock in the blood pressure. AGN almost always means hypertension. Nephrotic syndrome, normal or even a little low. And our final major player is hemolytic uremic syndrome, or HUS. For HUS, you just need to memorize this triad. It's 1, acute renal failure, 2, hemolytic anemia, which means red blood cells are being destroyed, and 3, thrombocytopenia, which is low platelets. The classic exam question will be about a kid who had a bad case of diarrhea and now has signs of kidney failure and is bruising easily. That is your giant clue for HUS. Whew, we have covered a ton of ground. Now, let's just boil it all down into one last, super fast review. These are the absolute must-know points you need to walk away with for your exam. Key takeaway number 1. An infant with a fever that you can't explain, who's super irritable or just isn't eating well, you have to immediately think about a UTI. The ATI is going to test you on those subtle non-classic symptoms, so be ready. Next, remember the why for nephrotic syndrome. It all comes back to that massive leak of protein, especially albumin, into the urine. That's what causes the severe all-over edema. There's just not enough protein left in the blood to keep the fluid inside the blood vessels. And for acute glomerulonephritis, always connect it back to a recent strep infection. The 2 hallmark signs that are going to help you tell it apart from everything else are that high blood pressure and the dark tea-colored urine from blood. And that's it. We've covered the essentials, from the common stuff like UTIs all the way to those complex renal disorders. You now have the key differences and the priority actions fresh in your mind. You can walk into that exam knowing you are ready to tackle these questions. You've got this. Good luck.